News 46. Local coverage you can count on.
Basically, I take care of all types of pain. This could include headaches, neck pain, back pain, leg pain, and also cancer pain as well.
Pain specialists also help people in rehab too as well?
Some pain specialists do. Actually, I'm not involved with the rehab, but we do medical management as far as medications and other medications that patients use.
Is that part of the regular medical doctor where they refer you, or is this a referral process to go to you?
Most people have a referral, but they can also come and see me if they depends on their insurance as well. If they're not an HMO type, they can just come and see me. They don't need a referral from their physicians. But we try to stay with more of the referral system, but our doors are always open to new patients.
Pain specialists are as a doctor that a lot of people seek, especially migraines and what you said, back pain.
Correct. So again, we deal with a lot of different types of pain, including headaches, migraines, and low back pain. Most of my patients actually come in with back pain and leg pain.
Do you do a lot of controlling pain with medication, or what do you do?
Personally, I'm not a huge fan of opiates, so I try to cut down as much as we can. Unfortunately, the society, we've turned into people that need pills all the time, or we want a pill for every ailment. So I try to have more of a generalized approach. We do medications, procedures, as well as physical therapy and other modalities that are appropriate for each specific patient.
Exactly, for the specific patient and what they're looking at as far as that. So do you come in from Las Vegas, or are you here all the time?
Correct. Actually, my office is in Las Vegas. I'm next to Southern Hills Hospital. Basically, every Monday I'm here from 9 a.m. to 5 p.m.
And do you work out of Desert View too as well?
I used to. Several years ago, we did procedures out there, so we're actually back in negotiations with the hospital, trying to see so we can do some of the procedures here so people don't have to drive all the way to Vegas to have some of the procedures done.
If people are having pain that they can't seem to control, or that they're not exactly sure how to identify it, they need to call HealthCare Partners.
Absolutely, and also it also depends on severity. I mean, sometimes the pain could be something that's more underlying, that's more dangerous. So definitely seek help right away if this is something out of the ordinary. A lot of people that come in with chest pains and stuff, I want them to go to the hospital and everything first. And that's not a pain specialist issue. But again, it's important to figure out what's going on first.
Sometimes more serious things happen from just the slightest pain, and some people may write it off and say, oh, it's nothing.
Absolutely, that can happen. So again, it's always important to keep a good contact with your physician.
What about chronic pain?
Chronic pain, that's actually our biggest clients. People come in with being in pain for many years, and unfortunately, what happens is some of the physicians that they see, they don't know about all the new modalities that are out there, and then they just keep writing narcotics. And I think there's other ways to go about it. Not that we don't write narcotics, but we try to keep that to a minimum.
Some doctors look at some of the pain as being in their head.
Well, if I don't agree with that. Unfortunately, quite often pain is very subjective, so you kind of have to believe what the patient tells you, and sometimes there's not a reason for specific pain, but we try to ascertain as much as we can.